we talked about non-operative management for this gentleman, including oral medications, steroids, and he had injections. Any other oral medications you guys are including, in addition to anti-inflammatories or Tylenol? I like gabapentin for some of these patients who have a really kind of burning neuropathic type of pain. I in my practice, I do not prescribe opiates. I have a very hard rule for any preoperative narcotics. If patients come to me on them, I request that they come off of them before surgery, particularly for cervical spine surgery. But any other thoughts here?
I think how liberal are you with the med or dose pack? That's that thing that,
Yeah,
I it's almost that theoretical concern of a young person getting AVN. I always ask people if it's real. Like surgeons feel like it's real. But anyhow, I,
yeah.
I tend to avoid Medrodose packs, just do epidural steroid injections instead.
My policy is for young patients without any, uncontrolled diabetes, which I do see a fair amount of. I would say I have like a rule of, two in a calendar year is kind of my guide to them. So I find out if they've been on steroids for any other reason. Some people are, doing steroids for other random ailments. They may have had a recent mental dose packs, and I would tell them to avoid it. But for a naive patient, I give them one, and if they're actually seeing improvement and there's no weakness, I'll even consider a second to get them over the hump in addition with other PT to see, in the setting of a soft dip, if this really resolves on their own.